This is an open letter to my Congressman, Sam Johnson of the 3rd District of Texas. Dear Congressman Johnson, I know that you are against a public option in healthcare reform. In fact, you presented a resolution that those in Congress who voted in favor of a public plan must give up their government employee group insurance and enroll in that public plan. Fair enough, but by that logic, those who vote against a public option should also give up their government-provided group health plan and try their luck getting private insurance on an individual basis, as many Americans must. At your ages and with any pre-existing conditions, it's going to be tough to find an insurance company willing to cover you. But then, since you're in your 70s, you'll be protected by Medicare, the government-run program. Your website states that you want to get every American insured, and I appreciate that. But you don't tell us how. You support health savings accounts. Great. But it won't help the uninsured working poor very much, especially if they have pre-existing conditions. You support physician-owned hospitals as part of health care reform. These hospitals tend to be very profitable for the doctors who own them. And I know that of the groups that supported your campaign, the 4th largest donor group were doctors. So I understand from a political point of view why you support opening more of these hospitals. But nationwide, they are less likely to accept Medicaid and uninsured patients. So how does that help reach your stated goal of insuring everyone? You support health information technology to save time and reduce costs. So does President Obama. You support small business insurance pools to give small businesses more buying power. So does President Obama. So why, when I called your office to ask your position on healthcare reform, did they tell me he's against it? Your office was very clear that you were totally against a public option, but not so clear on what you were for that will really reach your goal of assuring that every American has the health care they need. Under the current system, people are dying because most insurance companies are profit-driven and not patient-centered. I asked the man in your office if it didn't bother him that the top 10 insurance company executives earn $11 million a year on average. Incredibly, he replied, well, does it bother you that a famous actress can make millions of dollars for one film? As I told him, no, I'm not against profit in general, just in healthcare. If I can't afford to go to the cinema, it won't kill me. But if I can't afford to go to the hospital, it just might. So it isn't enough just to say no. Your uninsured constituents may already hear no when they go to get health care. So how do we get to yes for every American? Congressman Johnson, I realize that you may not be able to support my views on health care reform, but you do owe me this. As my representative, you must stand for the truth. You have read the bills under consideration in Congress. You know then that there is no basis for the shameful lie that Sarah Palin told about death panels. You know that there are no plans to euthanize Granny. Thinking Republicans and thinking Democrats must work together for true American health care reform. But we must work with facts, not fears fabricated by special interests or those who want to run for public office. We must listen to each other, not call each other absurd names. And I challenge you today to call these lies what they are and help to steer this discussion into a productive conversation about how together we can best help both insured and uninsured Americans get the health care that they need.